Now, I am honored to introduce to you Reverend Sam Rudra Swartz, who will lead a discussion of yoga experts on benefits of yoga and its role in promoting the well-being of people. Rudra is a student of Swami Satchidananda and has practiced yoga for over 20 years. He is an active member of Integral Yoga Organization and the Integral Yoga Institute of New York, and has previously served as a director of Camp Yogaville, a children's yoga camp for 8 summers. Welcome, Rudra. The floor is yours.
Thank you so much, Ms. German. And thank you to the UN, the Permanent Mission of India, for celebrating this glorious practice of yoga, which takes so many different forms. I'm very grateful to have seen Mr. Stern's demonstration, and thank you to his advanced asana practitioners. It was quite an impressive display. I also thank him for pointing out that Patanjali pointed out that yoga is so much more about the mind and the well-being of finding a quiet mind. We learned from Patanjali that asana should be steady and comfortable, and how wonderful it would be if our lives were always steady and comfortable. Through the practice of yoga, doing asana in any form, and through meditation and following Patanjali's wisdom, we learn that yoga does calm the mind and helps promote well-being, very personal nature. Our well-being of a quiet mind allows what my teacher, Swami Satchidananda, taught was that the deep peace within us all can come forward. And it was in fact the great masters, most of whom were from India, that brought yoga to the West, that not only taught us these practices, whether it be asana, meditation, ethical ways of living to achieve that quiet mind. What most experienced in the presence of these masters was unconditional love and unconditional peace. And it's what drew many people and continues to draw people to the practice of yoga. As we celebrate this great day, International Day of Yoga, I'm honored to bring to you this panel discussion of 2 colleagues from around the world, Ms. Nouf Marwaai and Dr. Krishna Raman. We are 3 people spread out across the world, as many time zones as one can almost spread out and discuss yoga. Ms. Marwaai coming from Saudi Arabia and Dr. Raman from India. Ms. Marwaai is a yoga instructor from the Kingdom of Saudi Arabia. She started practicing yoga in 1998 because of some health challenges, which is also what brought myself to yoga, and has been practicing yoga for more than 20 years. She is the first certified yoga teacher in Saudi Arabia and the founder of the Arab Yoga Foundation. She was awarded the Padma Shri Award, India's 4th highest civilian award, in recognition of her efforts in popularizing yoga in the Arab region. She is currently the president of the Saudi Yoga Committee under the Ministry of Sports and a vice president of the Asian Yoga Asana Sports Federation. Welcome, Ms. Marwaai. I also welcome Dr. Krishna Raman. Thank you for being here. Dr. Krishna Raman has been practicing yoga since the age of 14. He's a pioneer in integrating Western medicine with yoga for orthopedic pain management. He's the founder of MediYoga, the MediYoga clinic in Chennai, India. And welcome, Dr. Raman. As we had our preliminary discussions about this panel, one thing the 3 of us all agreed on is the many benefits we've all experienced from our own personal practices of yoga, and we were all on the same page of the mental benefits as well as the physical benefits, and how at the core, the foundation of yoga, bringing forth our inner peace and acceptance of life as we experience it, brings the true benefit and the well-being from a practice of yoga. Each of us use our bodies and our minds to make this practice a laboratory for the constant discovery of a practice, which allows us to constantly discover more benefits than we could have ever imagined when we were brought to the practice of yoga, whether inspired by a teacher who suggested us to practice yoga, or if we were having challenges that brought us to wanting to find the benefits for our own well-being. I'd like to invite Miss Marwaai to start and comment on how her practice has personally benefited her in the development of her practice. Ms. Marwaai.
Thank you, Mr. Rudra. I would like to highlight that yoga is a very helpful tool for the body and the mind as well. And people from different backgrounds, health issues, mental issues, physical issues, even physical disabilities can actually find something to practice in yoga and benefit from. And from my experience, I was diagnosed with lupus erythematosus when I was a teenager, and I spent a very painful childhood with so many health issues until I discovered practicing yoga helped me a lot since I wasn't allowed to practice any hard sports and I had to stop going to school. So yes, yoga works on so many dimensions and can help physically, mentally, and psychologically as well.
Thank you, Ms. Marwaai. Dr. Raman.
It's a great pleasure to be here. And at the outset, I would like to thank our Honorable Prime Minister, Shri Narendra Modi ji, for having made this ancient science of yoga into an international event. So, my journey into yoga began at the age of 14. I hail from an exercise conscious family. My parents themselves exercise. So I went into yoga and felt very good. Though at that time I did not have a keen interest, it was more of a challenge. But the trouble began when I did the more difficult advanced asanas and ended up with back pain and hip pain and so on. And it took me several years to find the right teacher. And I came into contact with Padma Vibhushan Sri B.K.S. Iyengar. And 7 years of pain went away in 1 week. And I was into medical school at that time. And I realized that yoga has to be done with a certain extraordinarily precise technique. And this led me into medical research into the field of yoga when I saw patients in his institute in Pune, India, with mainstream medical problems who were recovering without the aid of surgery or medication, depending on the situation. And then I started using whatever medical research tools were available at that time with the use of ultrasound to show how the blood flow changes in many arteries in our body and the nerve conduction studies for patients with prolapsed disc and so on. So I think that our own body has to be a laboratory, and that is the true yogi who experiments on himself or herself and gets into the healing mode, and then we will be able to help everybody around us. But I think it is very necessary to reiterate that a medical view on the science of yoga is extraordinarily important given the current COVID situation today, where pranayama, which has been given by our ancients, is extremely valuable for COVID patients, for rehabilitation, and for those whom we call long haulers. So I think yoga has a great potential for every individual. So it's a universal science. It is not limited to anybody. It belongs to everybody. So I think we should remember that and spread it with harmony and love.
Thank you, Dr. Raman, for such beautiful words. Yoga is for everybody. A common theme. I mentioned I had my own challenges. I have a condition, an arthritis condition, which keeps me in a wheelchair much of the time. The fact that I'm still able to get on crutches and move around a bit has a lot to do with my yoga practice. It has, I would say, I would credit it with as much to do with my meditation practice and the complete practice of yoga as I would credit my asana practice, which is done mostly from the chair. Through this, many people would say not just that yoga is for everybody, but yoga is for every body. And much like you were discussing the laboratory of your own practice, and that you actually had pain, and then once it was adjusted and you were able to study it more, you were able to relieve your pain. I would love to hear now from Miss Marwaai, and maybe she would be willing to share some of her personal experiences from when her health challenges started to pick up, and maybe more specifically what you discovered in your own practice that started to make some adjustments. I know I'm a big practitioner of pranayama, the breathing practices, and you share that you're not able often to practice pranayama. So perhaps you could share some of that story with us now, Ms. Marwaai.
Yeah. So when I was diagnosed with lupus, and that time I was stopped from going to school, I was in high school, a lot of symptoms were bothering me physically and psychologically. On the physical level, I suffered from Raynaud's phenomena, and where my fingers would turn blue or yellowish. When I get exposed to cold, I wouldn't be able to write or use my extremities, and my joint stiffness in the morning. I would spend 45 minutes in bed before I can get up and move. My sleeping disorders as well, digestive issues, and on the psychological level, since my young age and the diagnosis with this disease and all the suffering and fear of future, I of course developed an anxiety and panic attacks. So the asanas helped me in those aspects a lot. Of course, there were a lot of asanas I couldn't do then, I can do now. And some of them I can't do until now, like advanced asanas due to my joints inflammation. But there is a wide range of asanas I can do, even in the Ashtanga style, which seems to be very demanding physically. There are things I can still do, and I saw a lot of rheumatic disease patients can still do. What I can do is the pranayams, because in one of the lupus attacks I had, it affected my lungs and caused me a tachycardia. I have a high heart rate, and due to that, I'm not allowed to practice pranayams except one or two slow types. But I focus mainly on my practice of asanas and very regular rhythmic breathing, and of course the savasana or the yoga nidra. That helps me a lot. And everybody can find something that is helpful for their own case and body, especially with the help with an expert if they have a health issue.
Beautiful. Thank you so much. You mentioned Shavasana, Yoga Nidra, the yoga sleep, the deep relaxation where we're not supposed to sleep, but I think we've all experienced that, not being able not to sleep, but that relaxation being so important to get deeper, deeper, deeper. And also, thank you so much for sharing that due to your condition, you had to adjust and not practice pranayama. So many people, I feel, sometimes feel if we can't do it like it's in the book, we're not doing it correctly. And of course, there are now more books about chair yoga that I could see something that reflects my practice. However, all of us do need to take the time to be very slow and adjust our practice and make these adjustments, whether it's not practicing pranayama or doing somewhat of emulating an asana as opposed to trying to do it like you see in the picture. And Dr. Raman, I'd love to hear if you would share maybe some examples in the medical field that you've seen where people were limited, but they overcame those limitations. I know you shared that about yourself, but maybe you've worked with some students or practitioners and could give us one or two examples of really seeing some improvement. I don't want to over dramatize it and say something miraculous, but I think we've all had little windows where we've seen something extraordinary occur due to our practice. Perhaps you could share some examples of what you've seen.
Thank you. So before I would come to that particular point, I would like to also say that asana is not about just doing the physical posture, like Sam, you already said, but it is also the posture within us. So with what posture do we face life? And that is what yoga is all about. When Patanjali says yoga chitta vritti nirodha, the fluctuations in the mind are stopped. It is how we position ourselves and pose and repose ourselves to face life's challenges. I think that is the ultimate goal of yoga. We begin with the physical and we have to transcend the physical and go to that level. This is something I would like to mention in the passing. Okay, now coming to my experiences, one of the very earliest medical histories that I faced with was a patient who had nocturnal cramps in her calf muscles for 27 years. Believe it or not, 27 years. And she had tried every single medicine under the sun and exercise, etc. But when I examined her and I found that certain asanas could help, and I prescribed that particular asana when I saw her on the first day. See, what we should understand here is, it's not a miracle. Yoga is pure physiology. If you understand the functioning of the human body, then you understand that yoga is physiology, yoga is anatomy, and yoga is biochemistry and so on. Now, when I told this patient that in about 3 to 4 days' time you'll be all right, she looked at me with disbelief and she said, so many specialists have told me I'm going to be, living with this problem, and are you so sure? I said, yes, believe it or not, and I still laugh when I look back at this incident. Exactly on the 4th night, she slept without pain. And she wrote, and the grateful patient wrote a small poem about her legs, and I still have preserved that note today, even today. That was the incident which provoked me to find out what happens in that particular asana with ultrasound, as the yoga demonstration took place about standing poses, how standing poses can improve the blood circulation in the legs. Now, I wanted to see exactly which asana, which blood flow, which artery, where the blood flow increases. And we did it. And we found exactly what we thought we will find, because ultrasound cannot lie. It shows the actual parameter of flow. And that is why this lady became better. So I have never forgotten this lady in my life. The other case was, let me go to orthopedic pain management. As I said, of course, I had chronic pain. And I think, again, I would like to mention here before I go to that case, I think it's all about the mind, like Sam, when you said so. I felt so much of frustration practicing yoga, and I was in medical school, and everybody would laugh at me. Doctors would even laugh at me and say, you can't do Baddha Konasana, you should not do Janushirshasana. But it was exactly the same asana which gave me relief, which had given me trouble. So I had a deep sense of persistence, I think, by God's grace. I think all yogis should have that persistence to continue, and the light will dawn on them one day. I think that is very important in our personal practice. I wanted to highlight that. The second thing is, coming to that orthopedic case history. Here was a person who had a slipped disc where the nerve was compressed and there was numbness in the leg. Conventionally, we would, of course, put them on traction and medication and physical therapy and so on. But this patient had tried all modalities, and they landed up in my clinic as a last resort. And sure enough, using props in the BKS Iyengar system, which I find to be extraordinarily precise in the medical sense, she became completely normal in 3 to 4 months' time. and I redid the nerve conduction study, which showed a normal response. And the neurologist who saw that could not, understand how it works. But I knew because I was a yoga practitioner. I think this is where it is very important that when we prescribe yoga as a therapy, one should also be a practitioner of yoga and not just, prescribe. If I'm a doctor prescribing a pill, that is one thing. I may not have taken the pill. But if I prescribe yoga, I should be a student of that science. I should have experienced every single problem in the asana before I can prescribe it. Only then I will know how to prescribe that asana. So this lady became completely normal. And I would like to tell you one more very, very medically interesting situation, which happened to a doctor friend of mine who had a condition where the heart had become dilated. Now, this gentleman was living on medication. Now, according to yogic science, these asanas are supposed to help. So I put him on those asanas. His own aunt was a cardiologist. And after 4 months of yoga, believe it or not, the pumping capacity of the heart had increased. Now, I would not believe it myself until I saw the report. And when I presented this case history in Pune, one medical physiologist came up and said, I would like to know how you did that asana. How did you get that result? I never knew it is possible. This gentleman was given 1 year's time to live. He lived for 6 years. And as a smoker, he continued to smoke and he lived 6 years. But that extra strength that his heart got never deteriorated till his very last. So I think there is much more to be explored in yoga. Many things we cannot explain. We need instruments, and many of the modern medical instruments cannot analyze and understand yoga because the logistics of yoga are totally different. We have psychoneuroimmunology. We have so many new sciences, but the tenets of yoga have already been established. I think it is important that before one passes comments about one science, one must become a student of that science before we experience the benefits of that science. So I think these 3 cases set me, and after that cardiac patient, I started doing research on how the cardiac chambers can contract or expand with yogic practice. And that was amazing. That was really an eye-opener for me. And after that, I've never looked back in the application of asanas wherever possible in medical, mainstream medicine.
So much for sharing those stories. So inspiring. Words personally inspiring me, and exactly what I think this panel is all about. To know that whatever you're experiencing, there can be some relief, or at least there can be some discovery. And to know that the medical technology can confirm that these advancements are made, or these benefits can be seen with diagnostics is truly inspiring to hear. And I hope everyone is as inspired as I am to hear this. And you mentioned 2 other things about the inner body. I've often found that in my own practice, it starts with something that feels like a good stretch. But as I continue the practice, I start to feel something deeper, an energy within, which I do believe, as the 3 of us discussed, is a gateway to our deeper consciousness. And you also mentioned a persistence, which Patanjali mentions in the 14th sutra of the first book of the Yoga Sutras. Yoga becomes firmly grounded when practiced for a long period of time without break and in all earnestness. At least that is the translation that is found in one of the volumes that I study. I would like to now invite Ms. Marwaai to just give us a few closing words of inspiration as we complete our talk today.
So I would say what Dr. Raman really shared already is very important and true. And as a clinical psychologist, when I was practicing yoga at that young age, and then I went back to school and I graduated and I studied psychology and I got my clinical training, I started seeing a lot of connection of why would yoga be that important, especially on the neurological level. It changes the brain chemicals. Now, a lot of studies are coming out and talking about how yoga helps, for example, the depressive symptoms. It improves depressive symptoms. And in the past, we used to say yoga doesn't heal depression. Yeah, yoga does not really heal depression, but certain types, active types of yoga like Ashtanga and Vinyasa yoga can help improve the brain chemicals and the secretion of GABA, which is important in anxiety, fibromyalgia, and depression. Even the chronic disease, we talked today about a lot of autoimmune disease around the world. Um, People show markers of inflammation, and the recent studies showed that yoga reduces the markers of inflammation in the body. So we go back to what we said about exploring with your own body. If I tell my doctors and I show them the Ashtanga or Vinyasa asanas, maybe they would say never try it, don't even try it and hurt yourself. But surprisingly, it's the main style that helped me overcome my fibromyalgia that I was diagnosed with because of lupus and a lot of other connective tissue problems. So I think it's very important to let the person explore and as well encourage different countries' authorities to support yoga initiatives and yoga training programs and yoga researches, because this is something that humanity needs. And I'm really thankful that in my country, Saudi Arabia, and following the Vision 2030, that is in its objectives more relevant to SDG 3 and its objectives for promoting health, we have a lot of initiatives for increase health and well-being and its activities, including sports and different activities. And that's how yoga was recognized under this initiative, to help the society get access to yoga trainings, yoga programs with good quality, good standards, and good services. Because in every society, especially during this pandemic time that is still going on, yoga is an important tool. It can be practiced at home during lockdown, prevent at least mental breakdown, or at least improve the mood and prevent anxiety, fear, sleeping disorders. Normal practice of hatha yoga style or certain practices like yoga nidra and savasana can actually help reduce the excitement of the sympathetic nervous system. Therefore, instead of the person going through an anxiety, then panic attacks, then insomnia, and then all the related problems that includes other physical disease related to stress, we can stop that there where it started, just using a simple practice like yoga.
So beautiful. Thank you so much. As you said, yoga is an important tool. And we've already said it's an important tool for everybody. It's an important tool for everybody. And I thank you for your continued work in your region, being an ambassador yourself to yoga, to where some may not be as open to it, but by showing that it transcends any limitations and can be an important tool for everybody. It is truly inspiring, and I thank you. And I thank you for being here and sharing with us today. Raman, do you have any last words for us of inspiration today?
Yes, I have 3 points. As Ms. Marwaai said, her doctors were initially reluctant to allow her to try the series of Ashtanga Yoga. As I mentioned, we doctors are trained in a particular way, but unless we're exposed to that other science and we practice it, we cannot comment. Which is why I think the time has come for doctors to start practicing yoga and uptake it in their daily life. Then they will be more open and they'll understand what is happening to the human body. See, we're all human beings, you see. So when I practice an asana, I may not know what's happening. I may be afraid because medical science has told me that this cannot be possible. But when I practice it and I understand the technique of it, I realize something else can happen. So it's very important that doctors should start practicing yoga themselves. Then the patient-doctor relationship will be far, far better, number one. Number two, it is well recognized, and we should reiterate that yoga is both preventive as well as curative. And since it is preventive, it can definitely bring down the medical bills for the entire humanity. And one more thing I would like to highlight for the yoga practitioners, for all of us, is that in order for our yoga practice to succeed and to bear fruit, there are 4 points we have to keep in mind. One is faith. When I say faith, I mean self confidence in ourselves. Without that, I can never practice even one asana. The second is patience. Even when we take a medicine, we should have patience for a few days till the effect of the medicine seeps inside. And the last two, as we say in the Yoga Sutras, Abhyasa and Vairagya. Abhyasa is practice, Vairagya is the tremendous zeal, the tapas to persist in the practice. And therefore, Abhyasa and Vairagya are like two wings of the bird, which when they flow together, only then they have effect. So I think if you have faith, self-confidence, persistence, Abhyasa and Vairagya, I think we should be able to do very well in our journey for health and for the entire world to take up to the journey and have good health and peace.
So wonderful. Thank you so much. So inspiring. Miss Marwaai, Dr. Raman, thank you so much. What an honor it's been for me to be on this little island of Manhattan, New York, that I happen to share with the United Nations and speak to you in Saudi Arabia and India, and how grateful we all are, although sometimes the technology is a little tiring, how wonderful it is to be able to discuss this today. You mentioned Abhyasa and Vairagya, and I mentioned a translation of Patanjali, and Abhyasa, effort towards steadiness of mind, is Abhyasa, is practice. And we see Abhyasa everywhere. We see everybody who practices Abhyasa with anybody who steadies their mind or concentrates on any art or any activity. This is Abhyasa, and this can be part of yoga. My teacher, Swami Satchidananda, said anything you do can be a meditation if you still the mind on that one thing that you're doing in that time. And also I'm very inspired to hear it's not what you can or can't do, or what yoga can or can't do. Find what you can do, relate it to the practices of yoga, and then seek and look for a depth of benefit that you may not even know is possible. And you won't know unless you at least try and practice and steady the mind and see what you can do. And this I find inspiring for anybody who would like to get into yoga, practice, study, meditation, anything. Just get started. Find a teacher, find a method, and it doesn't take that much time or effort. But if you're putting that effort towards setting your mind, you're practicing yoga. I'd like to thank the United Nations, the Permanent Mission of India, the ambassadors and staff for being such gracious hosts and being so helpful in getting this discussion to happen, bringing us together, providing the technology, and to Prime Minister Modi, 7 years going now, Integral Yoga of New York that I'm a part of. I've been so grateful to be included in this auspicious International Day of Yoga. So to many more years of discussing and practicing yoga, I thank you both for joining me today, and I thank you all who are watching today for listening and hearing what we've had to offer. Om Shanti, Shanti, Shanti. May peace, the peace within you, always be brought forth, and may we share this peace with one and all. Thank you.
Thank you. I think we should all practice pranayama in this COVID time. It's extremely important.